I am Vicki Roop, and I will be presenting Chapter 16, Resolving Ethical Dilemmas. Chapter 16 in Beaupert discusses resolving ethical dilemmas. This book focuses on the law as it relates to nurse practitioners. Ethical dilemmas may arise every single day in our practice. This chapter discusses what ethics are and discusses some common ethical dilemmas that we may encounter throughout our career. The basics of biomedical ethics. There is an overlapping between ethics and law. Beaupert explains that ethics is a branch of philosophy that discusses and analyzes what is good, not only for the individual, but also for society. Laws set the rules about what is legal and illegal. And while there is no one judge guiding ethical decisions, there are a set of guiding principles. And while some may devote their entire lifetime to the study of ethics, every person has the ability to analyze a situation and to determine what they feel would be the best outcome. Laws attempt to be black and white about what is wrong and right, but they rarely succeed. The line between right and wrong has many gray areas. In nursing and in medicine, the guiding general rule of ethics is to do no harm. In a chapter covering resolving ethical dilemmas, it would be impossible to think about the guiding principles of ethics without making reference to Hippocrates. His statement is make a habit of two things, to help or at least to do no harm. As clinicians, we need to be able to employ Hippocrates' guidance to our everyday practice. Every time something is ordered or advice is given, we should have a sound basis for ethical practice. This slide discusses the terms we often see in both nursing and medical ethics. The ability to prevent harm, remove harmful situations or actions that directly benefit another. Justice, treat others equally. Fidelity, being loyal, fair, truthful. Make sure to be the patient advocate and keep your promises. We also must have a good balance between good against bad, and we must also respect the autonomy that each one of our patients has. Each patient has their own set of values and their own rights, and we must always remain respectful of that. For a practical view of ethical dilemmas inherent to nursing, this book guides us to the Code of Ethics for Nurses from the American Nurses Association. Ethical pressures influence day-to-day practice and impact the outcomes of care. The ANA established the Code of Ethics for Nurses in 1950 to serve as a guide for nurses to have support in making ethical choices and to cling to the values and virtues that are directly related to ethical practice. The Code of Ethics was recently amended to adapt to the ever-changing environment of the nursing profession. On my notes portion of this slide, I added a link to the Nursing World website that discusses an article that has suggested several implications for nursing practice, including consideration of the everyday nature of ethical concerns in nursing at multiple levels. It discusses the usefulness of the code as a guide and the importance of an inclusive and thorough process for revising the code. This article states that each day, situations arise for nurses that require both decision and action and may include ethical dilemmas. Examples of the most common dilemmas, including errors and near misses, delegation, end-of-life care, the use of technology, and fatigue. Managing these challenges will contribute to safe, compassionate, and quality care. This slide lists some of the most common ethical dilemmas according to the American Nurses Association. Errors and near misses, delegation, end-of-life care, use of technology, and nursing fatigue can all lead to very serious ethical dilemmas. The article I referenced in the previous slide discussing the Code of Ethics goes into great detail on these items. What is the advanced practice nurse's role in ethical dilemma resolution? Well, the APRN is responsible for knowing what is ethical and for seeking out their resources when an answer isn't clearly achieved. As leaders, the advanced practice nurse should already have a clear view of what is ethical practice and should provide care guided by those standards each time. The APRN is responsible for staying current on laws and guidelines that have negatively and positively impacted others' practice. Learning from somebody else's good or bad choices can be an excellent guide in our daily practice. Making unethical choices can lead to fines, lawsuits, restrictions on our license, and even revocation of a practice license. Ethical dilemmas can create an unsafe environment for the patient and lead to terminal issues with the APRN's ability to practice. The rest of Chapter 16 goes into great detail on 4 examples discussing ethical dilemmas that may or may not impact a clinician's practice or their daily life. The first example depicts the happening upon a person in need of emergency medical help. It states that the nurse may want to help, but is fearful of helping and getting sued if something goes wrong because the nurse practitioner was practicing without a physician collaborator. Example 2 is a proposal from a pharmaceutical company offering money in exchange for a consulting contract. Example 3 is a pharmaceutical company offering to engage in activities that may or may not comply with the federal compliance program. And example 4 is contemplating if there is an insurance fraud taking place by offering your patient an alternate drug for smoking cessation since it is covered by their pharmacy and has similar side effects and benefits for smoking cessation. Example 1, providing care outside of practice. 4 considerations that an advanced practice nurse faces when deciding to respond in case of an emergency outside of one's practice. One consideration is a malpractice lawsuit. However, the malpractice lawsuit requires 4 elements be proven. A duty of care must be owed to the patients by the clinician. Number 2, the clinician has to have breached the standard of care. Number 3, the patient must have suffered an injury. And 4, that injury must be caused by that breach of the standard of care. Another consideration is patient abandonment. The clinician must be engaged in the patient's care. Passing by someone in distress is not in and of itself an act of abandonment, and state by state, patient abandonment is defined differently. A third consideration is the topic of reimbursement. As Beaupert states, in a roadside assistance situation, reimbursement is not an issue, and there is no system under which a clinician can submit a bill for such care. The reimbursable settings of care are office, hospital, nursing home, patient's home, and facilities. There is no procedure codes for the settings of sidewalk or grocery store. One last consideration is the advanced practice nurse's own sense of ethical responsibility. Are there already people helping the individual? Are my skills enough to be of benefit to the individual? What exactly can I do for this patient? And do I have the legal authority to diagnose and treat? Every day, nurse practitioners make situation-by-situation decisions about whether to become involved with clinical care outside of practice, but there is no legal mandate to offer services. Example 2 is accepting gifts or payment from a pharmaceutical company. When a pharmaceutical company offers a clinician a substantial reimbursement for minimal work, it raises suspicions that the company is looking to create a situation where the clinician feels obligated to prescribe that company's medication. Pharmaceutical industries created code of interactions with healthcare professionals. Clinicians must get a sense of what is right and wrong for their interactions with pharmaceutical companies. The compensation should match the amount of work and not be considered of the kickback nature. Overcompensation to secure a clinician for selling one's products is unethical, and it is the responsibility of both the pharmaceutical company and the clinician to be familiar with the code of interactions with healthcare professionals and to use that code as a guideline when making decisions that are questionable in dealing with compensation from pharmaceutical companies. Not only should compensation be reasonable for the services offered, but bona fide consulting arrangements are also highly suggested. Example 3 discusses accepting financial support from pharmaceutical companies. Pharmaceutical companies should not provide direct support for any event that may be held by individual providers. When a pharmaceutical company provides enough support that it could possibly make influence on referrals, orders, or prescriptions, it is no longer fitting within the safe harbor of the anti-kickback rule. A safe harbor from violation of the anti-kickback rule describes 7 specific guidelines. 1 is a written agency agreement must be signed by the parties. 2, a written description of all services to be provided throughout the term of the agreement should be provided. Number 3, a listing of precise times that this interaction or exchange will take place. 4, the terms of the agreement should last longer than 1 year. 5, compensation is clearly stated prior to beginning the arrangement. 6, no promotional service can violate the state or federal law. And 7, compensation must be reasonable. Example 4 discusses prescribing medications. As Chapter 16 points out, even though it may be ethical to try to save the patient money, it is also illegal. It is fraud. Beaupert states that prescribing Wellbutrin instead of Zyban for the client to use while quitting smoking is unethical. Wellbutrin is covered by the individual's insurance, but is to be prescribed for depression. The provider must be able to be in agreement with its client that he or she is truly suffering from depression and not using depression as an angle to get their prescription for free to help in their goal of smoking cessation. The provider and the client must truly agree that somebody is suffering from the definitive diagnosis. Otherwise, it can be seen as fraud in the legal system. Pros and cons of resolving ethical dilemmas. Pros are very clearly that a truly ethical practice will be able to treat their patients and each situation while preventing harm, treating others equally, maintaining honesty, avoiding unnecessary harm, and by demonstrating respect to human life. The ability to practice with a clear conscience is quite obviously a pro in any advanced nurse's practice. Cons are simply that ethical dilemmas will arise throughout day-to-day practice. They will place providers and patients in a position to make decisions that don't always have a clear answer. These gray areas can cause confusion and sometimes hard feelings when the provider and the patient don't see eye to eye. However, a truly ethical practice will remember that the benefits must outweigh any harm. Ethical analysis. Nurse practitioners might approach each situation with ethical considerations in the following manner. Beaupert's Chapter 16 prioritizes gathering information at the top of this list. Find out whether or not this question is a legal or an ethical question. Are there laws governing this specific situation? Consider all the laws governing your scope of practice, any kickbacks or anti-kickback violations, patient privacy and confidentiality, billing Medicare and Medicaid and insurance companies, your Good Samaritan laws, and any end-of-life issues, such as a decision to do not resuscitate. Who is benefiting from this situation and how? Who could be hurt or not hurt by this situation? What does your gut tell you about the right course of action in this situation? Is there an outside influence that is persuading me to choose one side or another? What would another ethical practitioner do in this situation? What does my state board of nursing say about this situation? Will my malpractice insurance cover me in this situation? The chapter also encourages us to structure a plan, identify a course of action that we would like to take, identify alternate approaches, and to identify the pros and the cons of that course of action as well as the alternative approaches. If it is a patient care matter, present the issue to the patient if the situation allows. Ask the patients for their input or their guidance. If there is a code of conduct from a governmental agency or a professional society, we must follow that which dictates the code. Make a decision, prepare for yourself an argument that supports your decision, and carry out your plan confidently. If you decide later that you have made the wrong decision, as we all will, we must use that as an opportunity to learn from our mistakes. Thank you so much for listening to my presentation today. If you have any questions, I would be happy to try to answer them for you, and I look forward to open discussion about my slides. Thanks again.